Welcome to Science Podcast. So, I'm talking about cervical cancers. What is cervical cancers and the sign of cervical cancer? I'm a cancer survivor myself. And so is my man. He's a cancer survivor himself. So, about 13,000 American women will be diagnosed with cervical cancer this year, according to the Center for Disease Control and Prevention. While they may not seem like a lot, especially when compared with the rate of breast cancer, which roughly 1 in 8 women will develop in their lifetime, it's still the third most common gynecological cancer in the United States, said Carol S. Clear, MD, gynecologist, oncologist at New York Presbyterian Columbia University Irvine Medical Center. The good news that largely is to the pap smear is the HPV test and the HPV vaccination. There's been a significant decrease in cervical cancer risk in developed countries over the last 50 years, said Dr. St. Clair. What more experts anticipate the number of new cases of cervical cancer will continue to decline in women who has been vaccinated. Now, for not so great news, signs of cervical cancer can be easily missed because its symptoms mimic those of many other conditions. And if it's not caught early, survival rates drop rapidly. Here's what you need to know. In short, cervical cancer is, in almost all cases, the result of sexually transmitted disease, said Amanda Nichols Fader, MD, Associate Professor and Director of the Kelly Gynecology Oncology Service at Johns Hopkins School of Medicine in Baltimore. Nearly all cervical cancers is caused by HPV. It's extraordinarily rare otherwise. One of the most commonly transmitted infections affecting hundreds of millions of women around the world. A shocking number of men has HPV. The good news is that HPV and cervical cancer are preventable with the HPV vaccination, one of the safest and most studied vaccinations over development, said Dr. Fader. It is important to know that not all strains of HPV could cause cancer. There are about 200 subtypes of HPV that has been identified, and those about 40 or so are spread by sexual contact, said Dr. Fader. About 80 to 90% of cervical cancers are due to HPV 16 and 18, but some rare types can also lead to cervical cancer, she notes. There are 3 approved HPV vaccinations and are 3 effectively protective against HPV 16 and 18. We can say that any HPV vaccine will protect against the vast majority of HPV-related cervical cancer, but none covers an absolute 100%, said Dr. Fader. This is why regular screenings are still recommended for vaccinated patients, she adds. Cervical cancer is most commonly diagnosed in women between the ages of 35 and 44 and are really affected women who are under 20, said Dr. Fader. About 15% of diagnoses are made in women older than 65, she adds, so share this with the women in your family, is what she's saying. Share this with the women in your family. Share it with the women in your family. Share it with your friends, any woman that's close to you. If you experience any of these symptoms, bring them to your doctor's attention. It may be nothing or it may be something else, like another STD, but the key to survivor's early diagnosis. Yes, cervical cancer is one of that we beating, but not into submission, said Nicole Williams, MD, the board-certified gynecologist, surgeon, and founder of the Gynecology Institute of Chicago. If you haven't had a pap smear in the last 3 to 5 years and have these symptoms, you need to be seen. This doesn't feel like cramps, but more of a vague heaviness, like something just doesn't feel right, said Dr. Williams. You may feel some pressure or even pulling, and things feel a lot heavier than they did before, she adds. Signs of cervical cancer tend to creep up over time, and that's what can make it tough to spot. You just don't feel well, but may be unsure why, said Dr. Williams. Now, so she said during the pap smear, you're not going to be able to feel it, but pressing around on top of your stomach. But if you slide your finger into your cervix, it should feel smooth like a shiny pink donut, said Doctor. If you feel something rough, instead see a doctor ASAP. Bleeding after sex is the most common symptom of cervical cancer. It doesn't have to be a lot of blood, but even a little irregular spotting should be brought up with your doctor, said Dr. Williams. You may also experience a dull, achy pain, particularly after sex. That said, these symptoms can also be indicative of fibroids, STDs, or vaginosis. That way, cervical cancer is a great pretender, said Dr. Williams. But if you're experiencing any of this, it's generally not nothing, she asked, to see a doctor about what it could mean to have pain during sex. Now, she also said if you're doing something that may alter the flow or stop your period, such as taking a hormone birth control, if you use a hormone-containing IUD, it's normal to experience some irregular bleeding or spotting. Yet, if you're not doing any such thing and you're bleeding irregularly, there's something you should bring up to your doctor, as could be as early warning sign of cervical cancer or something else, said Dr. Williams. An early sign of cervical cancer can be persistent, and persistent is the key here. Vaginal discharge that is watery, mucus-like, or pustulent, which can be quite smelly, said Dr. Williams. A very foul-smelling discharge which occurs when a tumor starts to break down. It's an indication of much more advanced disease. It's tough to tell the difference between discharge that is a sign of cervical cancer and the many other reasons you might have abnormal discharge. Because remember, discharge is a natural, normal thing. Plus, discharge often changes throughout your menstrual cycle. This is yet another reason to get routine screening to rule out anything serious, said Dr. Williams. Not everyone with cervical cancer has the symptoms, but low back pain has been associated with cervical cancer, said Dr. Williams. In advanced cases of cervical cancer, the cervix can become so large that it puts pressure on the lower back. Again, symptoms such as this could be indicated of lots of things, many of them much less serious than cancer, which can make it difficult to spot the signs of cervical cancer on your own. One of the scariest things about cervical cancer, though, is that it is often asymptomatic, meaning you could have no symptoms at all, said Dr. St. Clair. This speaks to the critical importance of good screening and prevention, she adds. Cervical cancer is typically diagnosed during a pelvic exam by a doctor or during a routine pap smear or HPV screening, said Dr. St. Clair. Gynecologists follow screening guidelines set forth by organizations such as American Cancer Society, American College of Obstetrician and Gynecology to help them decide when to administrate which test. It has a lot to do with the patient's age, medical history, said Gary Austin, MD, chair of the Pathology Department of Advocate, Illinois Massey Medical Center. For example, although a Pap test is currently recommended for women aged 21 to 29, the HPV test is not. Since many women in this age group will have an HPV infection, but their immune systems are able to get rid of it, said Dr. August. At the other end of the spectrum, if a woman is older than 65 and has never had cervical cancer or precancerous symptoms, she may not need to be screened at all, either by Pap smear or HPV test. Every woman in her history and circumstances are different, so always consult your doctor. Ask for any test you think you should be getting done. I can identify cells on the slide that looks abnormal, said Dr. August. While in rare cases, the abnormal cells mean that the patient already has cancer. The Pap test is also important because using it, the pathologists can identify cells that are not already cancer cells but have the potential to become cancer. That's why regular screenings are so important. Still have your doubts. If your tests come back abnormal, you might need a cervical biopsy. That involves taking a tiny piece of cervical tissue, which is then examined by a pathologist under a microscope, said Dr. August. If the pathologist finds that the biopsy shows a precancer, the gynecologist will treat this part of the cervix. This can mean removing a large piece of tissue in a procedure called cone or leap. Again, the pathologist will examine slides made from this procedure to be sure that precancer has been completely removed. If a patient already has cervical cancer, a gynecologist can usually see the tumor during a pelvic exam, but will need to take biopsy from it using microscope slides from the tumor biopsy. The pathologist will confirm whether it's cancer, and from there, your doctor can begin planning treatment. When symptoms are caught early, cervical cancer is preventable as doctors can treat them before they become a problem, said Jessica Shepard, MD, a board-certified OBGYN in Dallas. If all of us proactively got regularly screened and treated appropriately, we can get rid of cervical cancer in the U.S., she adds. Yet, despite this fact, 1/3 of U.S. women diagnosed with cervical cancer die from the disease, according to American Cancer Society. One reason for this concerning statistics is that many women are hesitant to discuss specific sexual health issues their health care provider, says Dr. Shepard. What's more, it's critical to get the HPV vaccine passed. Here's why you're excused not to or total BS, she says, which drastically reduce your exposure to cervical cancer. Pap tests should start at the age of 21 and be done every 3 years as recommended by the CDC. See the complete guidelines for women ages 30 to 65. A combination of the HPV test and the Pap test can detect nearly all cervical cancers. We need to think about this vaccination as a preventive measure that support a woman's overall health, said Dr. Shepard. Prevention is so important because it gives us the potential to erase the disease. Not completely erase it, but to minimize it. So that's about cervical cancer, everyone. I'm telling you, if you get it detected early, they can cure it. But you have to have the screening and make sure you get the HPV vaccination or do everything you can, because cancer is a big, big disease. So many of us have cancer. So many of us die from cancer if we don't get the right treatment. But fortunately, I have a great oncologist, and my man, he also has a great oncologist, so we were lucky. But not everyone is lucky. But I'd like to thank you for listening to my podcast. Please give it a 5-star review on Speakers, Anchors, iHeartRadio, Spotify, wherever you listen to your podcast. Please share. If you'd like to leave a comment, leave it on this podcast, or you can leave it at sv76675@gmail.com. You can follow me at son.ia, Instagram, 9795. Sonia Santiago, Twitter, Sonia Santiago, Pinterest, Sonia Santiago, Facebook. You can also go to my website, http://podcasters.com/wordpress.com, and have a blessed night.